Hello,
Yes.
I'd like to welcome everyone to the November 24th meeting of the Health and Education Committee. Before we begin our business, I will need to read the electronic disclosure. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Do I have a motion?
So moved.
Second.
Okay, so do me a favor, since most of us are, will you announce your name before you make your motion? That way Rachel can take minutes.
Wayne Blair made the motion.
Joe made the second.
Very good, thank you. All right, Rachel.
Most of them I can recognize, but thank you. I'll call the roll.
Thank you.
Commissioner Cook?
No.
Commissioner Blair?
Protest, Carol. I'm sorry, go ahead. Go ahead, Rachel.
Okay, Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes, thank you all.
Thank you.
All right, our first order of business then is to approve the meeting minutes from our last meeting. Do I have a motion for that?
Madam Chairman, I have reviewed the minutes and find them in order and without objection. I move for their approval. Wayne Blair.
Second. Carol.
Very good, thank you. Rachel, if you go ahead and call the roll.
Commissioner Key?
Yes.
Commissioner Blair?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Cook?
Yes.
Chairman Allen?
Yes, thank you. All right, next up we have the Health Department report. So LaShannon, are you with us?
Yes, ma'am, I am. So good evening, Mayor Ketron, Madam Chairman, and Commissioners of the committee. Tonight, I will be presenting the Health Department report of community health outreach and COVID-19 updates, along with Dr. Lori McDonald, which is the reason why I have my mask on. She's sitting right here next to me, and she will talk briefly about the COVID-19 vaccine. So at this time, will you please take a look at the October 2020 report of community health outreach? Our three columns labeled protect, promote, and improve have not changed much since our staff continues to work hard to ensure that we test, provide education and guidance to help mitigate the spread of COVID-19 in our county. Last Thursday, November the 19th, we participated in the third annual statewide Fight Flu Day and doubled our numbers from the previous year. Currently, we're offering no-cost walk-in flu shots from 1 p.m. to 3 p.m. at our health department. COVID-19 update. We will continue to offer drive-through COVID-19 testing at our Murfreesboro site located at 100 West Burton Street at no charge to anyone who wishes to be tested Monday through Friday, 8:30 a.m. to 12 p.m. Tests are free and without restrictions. Currently, we are testing around 400 to 500 people a day for COVID-19 with the oropharyngeal swabs and continuing to work all areas of public investigation that goes along with positive cases and their contacts 7 days a week. So just to let you know about a couple of numbers. So this past Monday, November the 23rd, with our extended testing hours, we were able to test 876 individuals. Combining Monday with last Friday, we tested roughly 1,500 people, which is higher, of course, and it is expected with the expanded testing hours and Thanksgiving holidays right around the corner. As a reminder, the Rutherford County Health Department will be closed and will not provide COVID-19 testing on Thursday or Friday of this week. However, we still will contact and investigate all positive cases in their contacts as we normally would do 7 days a week. Additionally, on Monday, November the 30th, we will be extending our COVID-19 testing from 7 a.m. to 5 p.m. And Tuesday and Friday, we will resume our normal testing hours of 8:30 to 12. One of the number one questions that we are asked is about results and how do I get my results? So typically the average turnaround time to receive COVID-19 results is 3 to 5 days. However, please note that this time of waiting could increase depending upon test volume. Information will be provided to all participants at the testing locations on when and what they can expect after being tested. Anyone tested at our health department will be contacted by our local health department staff and/or Tennessee Department of Health staff with their results. Additionally, something that I'm pretty sure that's kind of new to a lot of people is our COVID-19 testing results are also available on a portal and can be resulted out at tntesting.extendhealthcare.net. This information will be provided on our county Facebook page tomorrow. Please note that positive results may also be reviewed and downloaded via this portal. However, anyone who is positive will also receive a phone call from a staff member from the local health department. One thing that is extremely important is that we must have everyone who is being tested, please answer your phone, especially those who are positive, during the time that you're waiting on your result. So I'll move forward and then I'll go for questions at the end. So safer gatherings during COVID-19. So in this week of Thanksgiving, which may look a little different for all of us, as I think we all are aware of, as compared to most years, we have to heed the advice of public health officials for safe gatherings. My heart is full of gratitude for the staff, the community, our many community partners, and each of you on this call for enduring the many obstacles and challenges of COVID-19. While we can acknowledge that celebrations may look a little different this year, we ask everyone to review the CDC's recommendations, which can also be found on the Rutherford County government's Facebook page. They can be put into place with minimal impact to your celebration. So the CDC does recommend for everyone to wear masks. Also, making sure that we're staying at least 6 feet away from others who do not live with you, washing your hands often with soap and water for at least 20 seconds, or using hand sanitizer with at least 60% alcohol. If you are attending a gathering, it is recommended that you wear a mask unless eating or drinking. Avoid going out and in and out of food preparation areas, and using single-use options like condiment packets, as well as single-use forks and spoons. If hosting a gathering in your home, it is recommended that you host a small outdoor meal with family and friends, and you're limiting the number of guests. The CDC also recommends talking with guests beforehand about your expectations for protections of health measures during the gathering. If celebrating indoors, the CDC does recommend opening all windows, limiting the number of people in the food preparation areas, and having people bring their own food and drink, and/or having single-use options again. The CDC also warns that travel increases your chance of getting and/or spreading COVID-19, and suggests staying at home is the best way to protect yourself and others. If you do travel, it is recommended that you check the travel restrictions before you go. Come to the health department and get your flu shot before you travel. Always wear a mask in public settings and on public transportation, and staying at least 6 feet apart from anyone who is not in your household. Of course, we want to continue washing our hands or using hand sanitizer often, and avoid touching your eyes, nose, mouth, and your mask. Bringing extra supplies such as masks and hand sanitizer along with you. So in general, what we're seeing, and I know Dr. Mack's going to talk a little bit about this briefly, is that about half of people with coronavirus actually typically don't show symptoms that would necessarily prompt them to get tested. So we do caution holiday travelers that a negative coronavirus test does not mean that you cannot get sick. All that it means is that you were negative on the day that you got tested. So we ask that you continue to practice your 3 W's of wearing a mask, washing your hands, and washing your distance. There are also additional recommendations, which I'm not going to go through at this time due to time's sake, and also activities that can be found by visiting the CDC's website. So at this time, I'm going to turn it over to Dr. McDonald, who will talk briefly about the COVID-19 vaccine.
Thank you.
Hi, everyone.
Hello.
So as all of you probably know, if you've watched the news, there's 3 vaccines that are kind of the front runners. We've been chosen, the state of Tennessee has been chosen as one of the 4 states that is going to be rolling this out fairly quickly. They're all almost completely approved, with the exception of the Astrazeneca, or the one that's known as the Oxford, which is in the end of the phase 3 trials, and it's about to be approved, I believe. So just to give you an idea of what these vaccines are like, they're all 2-shot vaccines. The only thing that really varies in them is that the time between the first and second vaccine is slightly different with the Pfizer vaccine, which is the one that we anticipate that we'll be using here in the state. So essentially, the Moderna one, you probably all heard these names. It's 2 shots, 28 days apart. The availability right now is we expect to have about 20 million of these doses by the end of December. They have to be stored fairly cold, and I'll give you both the Celsius and the Fahrenheit for the metric people in the world. -20 Celsius, which is about -4 Fahrenheit, has to be stored. They're about 95% effective, which is really huge. Most of the flu vaccine that we get is about 50 to 60% effective, and we're pretty happy with that. The only other vaccine that's as effective as these ones that are rolling out for COVID is measles. And the measles vaccine is highly effective. So this is all really good news. Now, the Pfizer is also a 2-shot preparation, so we'll have to have people come in and come back within 14 days for that shot. It has to be stored at a colder temperature, -70 Celsius, which is -94 Fahrenheit. That's kind of dry Iceland, but we'll get through that. That's the one that I think I understand that we'll be using in the state of Tennessee. It's 90% effective, which is also huge. The last one is the one everybody hears about, the Oxford one. That's an Astrazeneca product. It's also 2 shots, 1 month apart, and it can be stored in warmer temperatures, 2 to 4 degrees Celsius or 36 to 46 degrees Fahrenheit, kind of your refrigerator kind of range. They did an interesting study with that one. They used the full dose and they did the 2 shots, and these are large trials with 30,000 plus people. And they found that the initial 2 full doses was only 60% effective. Then they did a half dose followed by a full dose, and it came up to the 90% level as well. So bottom line, they're all essentially very, very protective, or they're very good. We anticipate that hopefully by the end of the year we'll have this available so we can start getting first responders, healthcare workers, public health folks, any firemen, police, all of those folks done first. I would expect the next group would probably be other high-risk individuals, nursing home, people with a lot of comorbid conditions. I think this is really quite remarkable if you think about vaccine and how it's actually produced, how we've done it so quickly. And there's been really no downside to the people that have received the actual vaccine as opposed to the placebo. There was a few situations that you probably heard on the news where somebody, 35-year-old died or whatever. Those folks were in the placebo group. So all in all, the folks had very little side effects that received the actual vaccine. So we're looking forward to that so we can move out of this. I think we would all agree 2020 has not been the best year of our lives. And it would be nice to finish the year off with some positive type information and success with this, which I think public health is going to be a leader here. We're good at this. You just heard LaShawn say how many people we tested in the last 3 working days, which is enormous. And I think we'll be a leader in getting this out to the people.
That is very exciting news. Thank you for sharing that. Are there any other questions for Dr. McDonald or for LaShawn?
I have a question.
Yes.
For either of them. The contact tracing, I'm sure, is a tough task. But can you speak to now the numbers of days that are required for the quarantine? Has that stayed consistent? I've heard various numbers. Could you speak to that for just a moment?
Yeah, to my knowledge, nothing's changed in terms of the quarantining amount of time. I mean, the folks that are positive, you have to go back to whether they were symptomatic or asymptomatic, and you're looking at about 10 days. And the folks in quarantine, 14 days or longer, depending on the particular situation. Everyone's just a little bit different depending on symptomatic and illness and comorbid conditions.
Very good. Is there anyone else? Did you have a question, Commissioner Phillips?
Yes, if you don't mind. Are both of the vaccines identical, number 1 and number 2?
You mean, oh,
The
you
first-
mean, yes. You mean in terms of the first and second of the same company? You don't
No.
mean?
I mean,
I'm
the
sorry.
first injection you get, is the
Yeah.
second one identical to the first one?
As
Or are
far
they
as I,
different?
as far as I understand, they're the same.
Yes.
There has been some, with the AstraZeneca has used different amounts of the same serum. And for some reason, which I think makes sense from an immunological point of view, the half dose followed by the full dose was more effective. And I just think that's the immune system responding.
Thank you.
Very good. Excellent questions. Is there anyone else that has any questions for LaShannon or for Doctor? All right, thank you.
I've got a suggestion, and it may be inappropriate and shut me up if it is, but I'd like for county government, our commissioners, to kind of set an example. And if there's any way, the health department could sit up in like room 205 at our December commission meeting and allow county commissioners, the mayor's office, to get injections and then follow that up in January and get the second injection. I'd make that as a suggestion that we would set an example for all the other people in the county.
Mayor, did you have?
Commissioner.
I'm sorry.
Yeah,
I thought I saw the mayor raise his hand.
yeah, this is Commissioner Gurley. I'd like to, I think the first doses are intended to go to those that are protecting us, first responders, those that are working their selves raw in hospitals, et cetera.
I'm not disagreeing with that at all.
Yeah.
I think the first, when it becomes available to people of our age, and you and I both fall in that other age group, then I think it would be appropriate to do that.
Mayor, did you have something to add?
Yeah, Madam Chair, I was on a conference call at 10 o'clock with the governor and the mayors in the mid-state area. He gave us a briefing on that, while at the same time at 10 o'clock, I had Steve go over to EMA. EMA met with folks from, they were all Zooming, I would assume, from the health department, first responders. They had asked to get a copy of the PowerPoint so we could learn more and start training and educating here in Rutherford County. They said it wasn't available. And so Steve walked in about that time, and so when the governor opened it up for questions, I asked the governor, I said, well, Governor, you just said that it was on the health department website. And I said, they're saying we can't get it. So he said, just bear with us. This is going to be a fluid document as far as the education is concerned. What Dr. McDonald has confirmed was the information that we are the Pfizer state, one of 4 to start in the pilot, because our state ranks high in the top 25. And so we were chosen for that. But there again, it is, and I think what Commissioner Gurley said, that it is it's going to be reserved for our first responders at first. It'll be way down the list before it gets down to school age kids. But I think somewhere in there where Commissioner Phillip was talking about probably the leaders, for those who want to step up and get it. Not all will want to do that, but that's their choice, I think, at that point. I think some places are even saying if you're a healthcare worker, it's going to be mandatory in order to get it. UT came out this past week and said that their students won't be able to come back in the fall. I mean, in the spring, if they don't have proof that they got that and the flu shot.
Wow.
I talked to Dr. McPhee at MTSU, and he said, we haven't made any statement like that at this point. You know, they just graduated Saturday.
Right.
So this is, like the governor said, it's a fluid document. It's coming very fast and quick, but you know, if we can save lives, then it's something we definitely need to look at.
Absolutely. Thank you so much for sharing that. That's an awesome update. All right, are there any more questions for Dr. McDonald or for LaShannon? And if not, I'll entertain a motion to approve their report.
Commissioner Gurley, so moved.
Do we have a second?
Wayne Blair, second.
Okay, thank you. All right, Rachel, will you call the roll for us?
Commissioner Phillips,
Yes.
Commissioner Gammon, Commissioner Gammon. His microphone's not on.
Yes.
Thank you. Commissioner Key,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gurley,
Yes.
Chairman Allen.
Yes, thank you very much.
Thank you.
All right, on the, I'm so accustomed to saying on your iPads, on SharePoint, we've got the community care report. And so, Mayor, did you have anything you wanted to share with us on that?
Yeah, just a brief update on community care. There are a couple of things. It seems like every step we take forward, we slide back to. We have to wait 12 days once we get an infection. We have to retest everyone. Somebody comes in, they're positive. We have to send them home, and then we have to retest every patient that we have. And so we've been struggling back and forth. And as of today, we're clean. With no positives. We did get an infection over with 2 children and 1 staff person over in the daycare center. So we just went in and shut it down until after Thanksgiving. We just couldn't afford to take that chance in the daycare center. We did have some extra time to do some things that this was on the plan, but last week we had caught a day of good weather, and we went ahead and sealed the parking lot and striped it. So that was an addition to the outside. As far as the construction on the inside, we've been having to use that wing as a triage unit for those once they get infected. So it's just kind of like we're ready to get started, and then we're balking every time that we tell the contractor we're ready to go, and then we get an infection. So we got to stop and wait another 12, 14 days. So it's there again, that's a fluid issue as well. So that's it in a nutshell out there.
Okay, very good. I appreciate that. All right, I'll entertain a motion to approve the community care report.
I've got a real quick question before we vote.
Yes.
We mentioned like healthcare workers and nursing homes are at the top of the list to get the vaccination, and I understand that. How are they going to get it? I mean, do they have to go someplace, or are we going to go to them? How are they going to get it? Is there a plan in place?
I don't know if Dr. McDonald's still on, but it's my understanding that we will, to nursing homes, we have to take it to them. We're not going to load them up and take them out. That's how we got infected out of community care anyway, is when we started busting them over to TOA, and their family members came to see them because they hadn't been able to touch them since March. And then so they got infected and took it back in, inside the facility. But it's going to be a logistical challenge. As Dr. McDonald says, we're getting 2 million. We have 6.5 million people in Tennessee, and that's just the beginning. How we're going to get them shots and come back in 12 days and get it done. It's going to be a real challenge.
Mr. Mayor?
Yes, sir.
Commissioner Gurley, I was a first responder back in 2009 with H1N1, and we were basically lined up at work and given the shots. So I think that's what you'll see at a lot of places, hospitals and so on. They're very used to giving shots, so they'll have everybody doing it, and that public so on that it's going to work out.
Back in the 60s, we used to go to the local school and take the sugar cube, right? Mm-hmm. The polio booster.
I was lined up at the Salk vaccine back in, let's say, a long time ago.
Yeah, well, it's just we'll figure it out. Well, our community will come together.
Very good. Rachel, did we have a first and a second on that?
No, ma'am.
Madam Chairman, I'll second it. Gammon.
Very good. Who was our first?
Commissioner Cook.
Commissioner Cook, very good. Thank you. All right, Rachel, will you call the roll on that?
Yes, ma'am.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes. Thank you, LaShannon and Dr. McDonald. Thank you so much for all your tireless efforts and what you all are doing directly on the front lines. We appreciate you very, very much. Just don't feel like we can say that enough. So thank you. And we are thankful for you. And I hope you have an awesome Thanksgiving.
Thank you.
Thank you. Happy Thanksgiving.
Okay, next on our agenda is the special projects report, the school building status report that's presented by Ms. Jolly. I spoke with her earlier in the week and told her if she didn't have anything, any major changes to this report, that it wasn't necessary for her to come. She said she's just been paying routine bills, but if anyone has a question on it, I'm glad to try to answer it. Or we've also got Doug and Mr. Spurlock. We could probably, between all of us, we could probably cobble together an answer, but I think it's a pretty routine report. We've had this for about a week. We've all had a chance to look at this. So are there any questions or anything?
Move to approve the report, Madam Chairman.
Very good. Thank you.
Second.
Is that David?
Second, Gammon.
Very good. Thank you. All right, Rachel, will you call the roll for us?
Yes, ma'am.
Commissioner Key,
Yes.
Commissioner Blair,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Cook,
Yes.
Chairman Allen.
Yes. Thank you. All right, Mr. Spurlock, you're up. School board.
All right, thank you very much. This is a request to amend a line item at budget 177, the Buchanan sewer system. We're requesting to amend this of $140,000 to replace the makeup air units for the pool areas at Laverne and Smyrna High School. These are not in a line item on our capital projects list for 2020-21, but it is included in requests from the schools in the HVAC area. If approved, this would bring the line item for the Buchanan sewer system down to 1.36 million. And this would provide us an opportunity to replace these heating units for these two schools. Motion to approve this amendment of $140,000 from the Buchanan sewer system project to move over to replace the heating units for the makeup air at the pool areas at Laverne and Smyrna High School.
Okay. Well, that 1.36 million, do you feel like that's going to get us what we need? Will we be able to complete the Buchanan project with that?
I talked to Mr. Lee. I think he's there now. He might address that, but he did tell me that that was enough. But Mr. Lee, if you're there, if you want to address that question.
Yes, sir. I'm here with Ms. Cook and Mr. Blair. Talked with our engineers, and they believe that 1.36 million should be enough to complete the Buchanan project. And the heating unit at Laverne, as we've discussed, is already out. It's completely out. So the one at Smyrna is not far behind. So this is an unexpected expense. We need to get these fixed, and this was we feel like we're fairly comfortable with this. Yes, sir.
And I have one more question on this. When the name of them, which is makeup air heaters, is that a description of what they do or where they reside? Makeup makes it almost sound like a backup heater.
No.
I'll go ahead. What it is primarily the air is drawn in, and there's a unit that heats that air. Now, it's not a problem in the summertime. Of course, we don't use our, we do, but we don't generally do that. But in the wintertime is when that air comes in. If we don't heat that air, obviously that area is going to be very cold in there.
Gotcha.
And we do, this is for our, wellness classes at Smyrna and Laverne High School. We do still teach swimming at those two schools.
Okay. And so you said the one at Laverne is completely out, and so this is maintenance on the one in Smyrna?
No, we're gonna, the one in Smyrna is about to go out too, so we're gonna be replacing them both.
Did anyone else have any questions? Mayor, did you have a question? No. Just talking with his hands. Okay, very good. All right, if there's no more questions about this motion, I'll entertain a motion.
Commissioner Gurley, move to approve.
Thank you.
Commissioner Blair, second.
Very good, thank you. All right, Rachel?
Commissioner Gammon,
Yes.
Commissioner Key,
Yes.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes, thank you. Under other business, I do have one item I want to discuss with you all, and that is, I spoke with Mark Tucker this week, and he was laying out for me some of the budget dates that we're going to have in the spring. And so May 25th, go ahead and mark your calendar for that. May 25th is our joint meeting with Budget, Health and Ed, and the school board. And we always hold that meeting at the Board of Education. And I think Doug has already reserved that room for us. Rachel's already been involved in coordinating the calendars, so we should be good on that. The other date is, and I mentioned this to you last month when we talked about changing our meetings to where you meet, following the first Monday. One of the months that this impacted was June, and June is a month where we typically have to finesse that date anyway because we need Health and Ed to meet before a budget meeting. One of our final meetings in June, because we don't meet in July. So that meeting date, the health and education meeting date, would normally have been on the 29th. We're backing that up to the 22nd. So if you'll go ahead and make those adjustments to your calendar for May and June, so May 25th, June 22nd, are when those meetings will take place. That was all I had under other business. Is there anything else anybody needs to discuss?
Madam Chairman, if I could, I'm not sure if Mr. Spurlock is still on.
Yes.
Is he? Okay, very good. Superintendent Spurlock, this is not a criticism, and I don't mean it to even sound like that, but the Public Safety Committee, the OSHA Department reports to the Public Safety Committee, and we get information on accident investigations and how we're doing as far as our safety program goes, but they don't have a lot of information as it relates to the school system as to what the school system does when they have an OSHA recordable accident. And what I'd like is for you or Mr. Broderick, either one, to maybe come back at our next meeting, whenever that is, and just explain to us when you have an accident that requires some type of medical care, what's the process you go through to maybe do an investigation and try to correct that situation where it don't happen again. I just wanted to be familiar with what the school system does. And I know we have a large number of employees in the system, and they represent half or a little more than half of our recordable accidents every year. So I'd just like to make sure that we're doing everything that we can to put safety at the top of our priority list and make sure our employees are as safe as they can be. So if you could, maybe at our next meeting, we could put it on the agenda and someone can go through, if we have an accident, this is the process we go through.
Absolutely, we can do that. Just to give you a little heads up, we do fill out a report, and we also, if there's retraining necessary, we do the retraining, but we'll report on it the next time we have our meeting.
Very good. Thank you.
Yeah, and just to clarify, Commissioner Phillips, your major concern there was being able to prevent future accidents, prevent anything that we can, whether it's through training or whatever. So prevention is really your focus. Is that correct?
Absolutely. We just, at public safety, our concern was that we know what's going on with the rest of the population, but we didn't have a real clear idea of what the school system was doing. I understand they're doing some investigations, but we just wanted to make sure, or I just wanted to make sure that we have a process in place when someone has an accident, that we try to take some corrective steps to make sure that that person or someone else doesn't have the same type of accident, okay? So that we're communicating within the system that if you're doing this, you know, instead of climbing on a chair, get a ladder, that kind of thing.
Very good. All right, is there anyone have anything else for this committee?
What about the December meeting?
We always keep the December meeting on the calendar, and that's usually tentative based on whether or not the departments have business for us. So in the days of COVID, it's very likely health department could have something for us. You know, we'll leave that open for school board unless Doug could tell us right now that he doesn't have anything. But usually there's always, you know, we keep it on the calendar, and then if I'm able to cancel it, it's a nice surprise. So that would be if we meet in December, the schedule is the 29th. That's the 4th. Yeah, that's, I'm sorry. No, it's 20.
It's the 29th.
29th.
29.
Okay. All right. So keep it on your calendar for now. And then if we're able to cancel it, we will certainly do that.
Very good. Thank you.
All right. I appreciate all of you more than you know. Stay safe. Have a wonderful Thanksgiving, and we'll see you soon. This meeting is adjourned. Thank you.
Thank
Bye.
you.
Thank you.